the first week, my joint pain went away. I'm serious. It was that fast.
In a week, joint pain that
No,
you had struggled with for decades,
yes,
gone?
it was gone.
Hi, everyone. I'm Anna Manuel. I'm the co host of Transform Table Talk Live alongside Dr. Maggie Yu. Today, we are doing an interview with Jane. Jane is an alumni from the Transform program who really needed help because her issues dated back many decades into her 20s and 30s. She's a proud 68-year-old woman now, but she'd been suffering with problems way back into her 20s. It all started with what they were saying was fibromyalgia and chronic fatigue syndrome. However, she never really got help to deal with those problems. Decades later, then, she got a diagnosis of psoriatic arthritis. And then about 2021, she started to really go downhill. That's when she was diagnosed with interstitial lung disease, Sjogren's syndrome, and finally, cancer. Jane was at a point in her life where she knew she wasn't getting any better. She was getting band aid treatments from her doctors, and she needed to do something different. That's when it was her husband who researched and found the Transform program and Dr. Maggie. They signed up together without any hesitation. She had her husband by her side for support. And I can't wait for you to see how she's doing now. Hi, Jane. Why don't you introduce yourself?
Hi, my name is Jane, and I live in Salt Lake City, Utah. I'm married, and I have two stepsons and a dachshund and a chiweenie.
Oh, and I know you love all of the children, but those dogs that live with you, they're
Yeah,
special, right?
they're the special children right now.
Well, Jane, thanks for spending some time with us today because you have quite a long list of mounting health issues that you've accumulated over the last many decades because your health problems really started way back in about your 20s and 30s, right?
Exactly.
Tell me what was going on.
Well, I was working, had been married and divorced a couple of times, and taking care of my widowed mother and just burning the candle at both ends. And I just was exhausted all the time, and I couldn't get clear answers from any doctor I went to. One of them once told me, patted my leg, and said, "Well, we're all tired, dear."
Mm, really dismissive, it
Yeah,
sounds like. Whereas you knew something inside, okay, this isn't quite right. Yes, I'm sure everyone's tired, but not quite like this. I'm exhausted.
exactly.
And so eventually you did receive a diagnosis. What was it?
Chronic fatigue and fibromyalgia. They were lumping a lot of things into that, but I also got diagnosed several years later with psoriatic arthritis.
Sounds to me like with those diagnoses, not only were you tired, but you had pain and joint pain.
Yeah, I was in a lot of pain, and I had a knee that swelled up, and they would drain it, but no one would say what was going on with it. I don't know how many years it was. After that, they finally decided I had a torn meniscus. Well, they fixed that, but the pain never went away, and nothing ever helped how I was feeling.
Was any doctor, yeah, targeting the issues here, telling you why this was happening or giving you helpful treatment options that were not just band-aids?
No, not really. They just gave me a lot of pills. Here, take this for the pain, take this for what have you. Try this and then come back in 3 or 4 months and we'll talk about it. And so I never got better because after a while you just quit taking stuff because it's like, well, this isn't helping me.
Okay. You just learned to live like this, to live exhausted and in constant pain, it sounds like, for decades.
Yes, yes.
On a scale of 1 to 10, where would you rate the exhaustion?
Oh my gosh, sometimes I couldn't. It was all I could do to get out of bed, to shower and go to work. It was a 10 some days, but when you single, you have to go to work. And once I got going, I was okay. It was just I wasn't sleeping. I was tossing and turning because I was in pain, and it was just a vicious cycle.
A bad cycle. And then as it came to the pain, scale of 1 to 10, would you also rate it pretty high?
Yes, it was anywhere between 7 and 10 most of the time. I never got really relief.
You were not feeling well. You were going
No.
about your day to day feeling poorly every
Yeah.
day. Okay. And so you lived like this for many years. But then a few years back, where
Yes.
things really ramped up and got worse. Tell me about what happened then.
Well, in 2016, I was diagnosed with interstitial lung disease out of the blue. I had had shoulder replacements. I was doing great after that, and then couldn't breathe. So that's when the interstitial lung disease was diagnosed.
All of the sudden, after your surgery, things were going well, but then you were very short of breath.
Yes, and I thought it was from the anesthesia, but it just kept getting worse. And they put me on oxygen.
Whew.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training.
So to get that diagnosis of interstitial lung disease, I mean, were they saying, where did this come from? Why is this happening? What can we do about it?
No, they didn't know.
Okay.
They had no idea. Just they handed me the oxygen and said, we need to do bronchoscopy and we'll find out. Well, they didn't, it was kind of inconclusive.
Hmm.
So there was no answer to that.
She went
So
through years of not getting answers and just accumulating
Right.
no diagnosis. Okay. So that was 2016. Then you said fast forward to 2021.
Yes, I had to find a new rheumatologist because mine retired. And she said, I suspect you have Sjogren's syndrome. But I had been to the Mayo Clinic a couple of years before and my markers didn't show up. Well, in 2021, they showed up.
Now that we
She
have
found it. In the meantime, my pulmonologist at the time said, well, this one blood test is elevated. I don't know what that is. I said, okay. He goes, I'm watching it.
Hmm.
And then I went to my primary care and she goes, oh, the doctor's watching this. Let's have you come back in a month. I said, no, why don't we go to the next step? Who do I need to see? And she said, you need to see a hematologist. And so I went to see him the same week as the new rheumatologist. So I got 2 diagnoses in the same week. But I did start cancer treatment like 3 days later.
Well, let's
After,
say it. Okay. Because we kind of glossed over it real quick. You said you started cancer treatment. You were diagnosed with cancer.
yes, it was lymphoplasmacytic lymphoma, which is bone marrow cancer, and I was at 73%.
This is a rare type of
Yeah.
non-Hodgkin's lymphoma. It attacks your B cells and, as you mentioned, your bone marrow. And this is commonly connected to autoimmune disease, but it is
Yes.
a rare type of cancer. So now, all of the sudden, you've got 2 new diagnoses that were they saying likely connected?
I don't know that anyone ever really came out and say that, but my husband researches everything to the nth degree, and he found that.
Yeah, yeah.
And so it just made perfect sense at that time. And then after getting into the program, it was like, oh, of
It's
course.
all connected. Okay, so my goodness, Jane, you I imagine had to start some type of treatment then for the cancer.
Yes. Yeah, they started me on chemo treatment and I went in once a month for 6 months. And then I went on a 2-year maintenance program every 2 months. But then I got really sick and they stopped the treatments because it was going to kill me.
Okay, but I know you went into remission at some point. So how did that
Yeah.
happen?
After the 6 months of rituximab was the treatment, I went in for my follow-up after the last chemo and the doctor said we could not find one cell. You're in complete remission.
Hallelujah. Now, this is a cancer that they never say is cured typically. And so
Correct.
complete remission is the best we can hope
Yeah.
for, it sounds like. And congratulations. So
Thanks.
then, were you feeling better?
I started to feel better and this was going into Christmas and I was able to host Christmas Eve and I was feeling great.
Were you still on the oxygen at this point?
I was still on oxygen
But you had a little bit more energy, it sounds like.
and
Okay, so after getting remission for the cancer, we're feeling well. Something must have happened to make you feel so poorly again. What happened?
Well, I kept getting COVID because
Oh,
I was singing in the choir, and
you should mention that
there,
you're a dedicated community choir singer. So
yeah,
that's really neat.
my Sjogren's really the only symptom at the time. I mean, I drink so much water that I didn't realize that that's was part of Sjogren's.
Yeah, you had a really dry mouth. That's
Yeah,
Sjogren's really attacks it's your immune system attacking all of the moisture producing parts of your body.
and keep in mind I was still doing the maintenance chemos, which
A
and
lot
it
on your
wasn't
body.
really chemo, but it was, medicine that's gonna keep your immune system down.
Okay, so how sick and how bad did you feel then? The
It was
energy level was just gone again?
it was gone. I was sitting in my chair. I couldn't do much at all. I would try to, putz around the house, and it just got so I couldn't even function.
You weren't living anymore. You were not feeling well.
No, not at all. I was kind of so out of it I couldn't even function. And
Mhm.
my husband came, he wakes up and 3 and 4 in the morning before work, and he watches YouTube things. And I come stumbling into the living room, and he goes, "You got to watch this doctor. I found somebody. I think they're going to help us." And I'm like, ugh, whatever. And he's like, "Come on, let's just watch it, okay?" I'm like, "Fine." And when I heard Dr. Maggie start talking, I'm like, "Oh, she sounds like she knows what she's talking about."
This is making sense.
And it was all me. It was like she was talking directly to me, like, "You have this and this and this." I'm like, "Yes."
Wow. And it was finally somebody who was maybe connecting the dots in a way that you had never seen that happen before.
Right. And that's exactly what my husband said. He goes, "She's got a system." And he loves systems. He likes the systems.
And so, did you guys have any hesitation then about signing up?
No, I didn't. He just said, "Call this number." And I'm like, "Okay."
Yeah.
And said, "Sign me up."
So you were in. Okay.
Yeah.
And that started the beginning of the journey for you to feeling well. Because tell me, you were on supplemental oxygen like all day long previously?
Yes, I had to wear it all day and at night. I still wear it at night, but I'm hoping by my next appointment that I won't have to do that, but we'll see.
But that
Yeah.
is something that with the inflammation and the scarring, typically it is progressive. It doesn't usually get better. Right? Are you using oxygen during the day at all?
No, not at all. And
No.
I used to have to drag my portable oxygen everywhere I went. I named him Milt because he's part of the family. And now Milt's in the closet. I don't let him out.
I
No.
love to hear that. Okay. So that is a direct result of changes you made from the Transform program?
Yes, I would have still been over in my chair if I hadn't started the program.
Okay. So the changes include you're off the oxygen during the day.
Yeah.
Hallelujah. That's exciting. How's the joint pain?
The first week when I got off gluten, my joint pain went away. I'm serious. It was that fast.
In a week, joint pain that
No.
you had struggled with for decades, since your 20s and 30s, is
Yes.
gone?
It was gone. That's what I remember telling my husband. I'm like, "I don't get this. Nothing hurts."
What's happening? Oh my gosh, what an amazing feeling.
That's what I tell everybody when I tell them about this program. Because they'll say, "Well, how's your arthritis?" I said, "I don't have arthritis anymore. Thank you."
And what about your energy level? How is the energy now?
Right now it's awesome, and it just keeps getting better every day. I'm amazed that, I mean, I even went up and down these stairs like 4 and 5 times yesterday. I haven't done that for years.
Oh my gosh, because you told me it was a 10 of 10 on exhaustion. So
Yeah.
where would you rate that exhaustion now?
I'm thinking it's more like a 5 now, just because of my age. I feel like I have to rest, but
But
I'm just
that's a dramatic
in my
improvement for you
car and I'm going places. It's like so weird.
doing things. And you said your joint pain was a 7 to 10. Would you say it's a 0 now?
I'd say it's a 0. I really do not have any kind of joint pain.
Oh my gosh, love to hear it. So people are going to want to know How did this happen? I know you mentioned getting off gluten was the big changer for you. What do you think is making the difference otherwise with your ability to get off oxygen and you're getting your energy back? How did this happen? I know it wasn't just magic.
Well, I changed my diet. Went through food mapping through the program and found I had a sensitivity to dairy.
Ah,
I was drinking milk, eating cheese every day of my life, with white bread.
yeah.
And I was one of those girls with bologna on it. And I just, I changed everything, meat and vegetables and supplements. The food was the biggest part of it.
So you went through food mapping and you learned some eye-opening things, but then it sounds to me like you also really learned how to eat properly, perhaps to balance your blood sugar.
Yes, the blood sugar. My mom was a brittle diabetic, and so I knew all about that, but doing it and living it are two different things. But once it like snapped in, it was like, oh yeah, I should be keeping my blood sugar up throughout the day and not skip meals. And I think that really helped. I don't eat a lot of sugar. Everybody cheats, but I've just decided I can't, it makes me sick. I can't keep eating those things because it hurts me. And so I've just given it up and I'm okay with it.
When you went through and you started testing your nutritional deficiencies, if you had any, did you have any? Like your B12, your iron, your vitamin
Oh,
D?
yes. All of that was just crazy.
So
And then when I got the virus, everything went crazy. All my levels were not normal. And that's and Dr. Maggie said, you have an infection. You need to get to the hospital.
okay. Oh, okay. So she recognized that you needed to be hospitalized at some point during the program.
Yes, because I was seeing her 3 and 4 times a week on our Zoom classes. And I think she probably just watched me, go down and because I get lower in my chair and I just be barely hanging on. And my husband started sitting through them with me. And I just remember this so clearly. She said, "Where's Ron?" I said, "Well, he's right here." And she goes, "I need to talk to him." And then I don't remember what she said, but it was like I was so sick.
Get her to the hospital.
Yeah, and she got me there.
And because of that interaction, did it potentially save your life?
Yes, yes, because when we got to the hospital, Ron was able to explain what had been going on and talk with the doctors on the case. There were 5 doctors trying to figure out what was going on. And I think with all the knowledge that we had, excuse me, learned in the last about 4 months, and he was able to say, look, this is what's happened. This is how she was before, and this is what you're seeing now. And thankfully, he was eavesdropping on all my classes.
What a loving husband. I love it. So she knew you had some kind of infection. What was the infection?
Long, way down in my lung.
You had a long haul infection and
Yeah.
it was causing your health to deteriorate.
Yeah, and it was pneumonia, basically, COVID
Pneumonia.
pneumonia. Yeah,
Those are the kinds of things that don't always end well.
exactly.
I know you get emotional when you think about Dr. Maggie saying, "Where's Ron? I need to talk to him," because it feels like that pivotal moment.
Yes.
What would you want to say to Dr. Maggie about that interaction?
That I love her and she saved my life. I really believe that. I think it was divine intervention.
Well, Jane, I am so thankful that you were able to get the treatment and the help that you needed. Once you got out of the hospital and you're still working with Dr. Maggie in the program, what happened from there? You just started to turn around and things got better?
Yes. Yes. I kept with the program. I kept going to my classes. I kept eating correctly and I just kept following along. And Dr. Maggie's, offered suggestions to help with my blood work and get them back to normal. And my blood work's pretty good.
Well, that's great to hear. For somebody with so many health issues, including cancer, including lung disease, including fibromyalgia and chronic fatigue syndrome, psoriatic arthritis, right?
Yeah.
to hear, well, yeah, actually, my blood work is good.
I know.
I love to hear, though, that you just kept getting better and better by working the program, applying the 5 pillars, applying her system, and learning your personalized information about how to correct whether it's your vitamin D. Did you have low vitamin D?
Yes, I had low everything. My hormones, my blood work, everything was just not optimal.
And so, have you retested to see if there's been improvement in any of that?
There has been. We're still tweaking those, but they're getting better.
Well, what
And
did you learn about your hormones? I'm curious to hear because I know you also had hormonal issues. You went through early menopause, right?
yes, I was 34, and I was told that, well, as long as you have 4 periods a year, you're fine. I'm like, well, but I'm 34. And that doesn't seem like enough.
And nobody really ever helped you then with your hormones. What did Dr. Maggie figure out was happening with your hormones currently?
I had low everything
You're
at
like,
that point. And so,
so you're in
um,
your 60s, but you had the hormones of somebody who is 80,
like,
90.
yeah, 86 years old, I think she said.
Not where you need to be at this stage in life.
No,
So you learned so much. It sounds like you spent 3 to 4 decades, right?
right.
Dealing with these health issues without really answers. But finally, you were getting to the root of what's causing all of this? How can we stop the attack and the inflammation in your body so you can start feeling well? And you finally got those answers.
Yeah.
I'm curious what that feels like for you.
I mean, I just feel like I'm starting to live again. It's like she said, I said, I'm sorry. It's like, I keep saying, I've gone to the mall every week. And she goes, no, you're living your life. You're doing stuff. Because that was one of the first things I told the gentleman I talked to right at the beginning. I said, I just want to go to the mall
You
and
just want to go shopping. Feel like a normal person.
go to the grocery store even. And it's just a miraculous that I've been able to start doing that more. I just feel like I'm in an awesome place, and I
That
just am very grateful.
I bet you are. So I'm curious then, what would you tell somebody else about the Transform program who is considering, is this right for me? Who would this program be for? And what would you tell somebody who's thinking about it?
It's for anybody that suspects they have autoimmune, or maybe not even diagnose things but feel like crap and no doctors will help them and they're not getting any better.
Hmm.
I would just say you've got to take care of it yourself. These doctors aren't going to help you. You need to learn how to advocate for yourself, how to read blood tests and things like that. Dr. Maggie's taught us how to take control, go get a blood test, how to read it, and she's there to help if we're having trouble understanding. And it's just made a lot of difference, and there's so much education through the program that you can learn anything.
So it's an education program, is what I'm hearing from you. So
Yeah,
this is then beneficial for somebody with any kind of chronic health condition.
exactly.
Okay, so what was your favorite thing about being in the Transform program?
um, I think my favorite thing is the people that I've met. And
Hmm.
when we start out, we're hooked up with a little group. There's 5 of us, and we're still in touch, and we still try to Zoom quite often. I just feel like I know them because they understand. They've got all the same problems as I do, and they were sick, but they're getting better. And I'm just so proud of them and how far that we've all come.
So
And
you gained a community of people.
yeah,
Jane,
so
would you say you are getting your life back?
I am. It's really awesome.
And I'm curious because you have your sweet, loving husband who not only never gave up on you, but researched to find this program, said we're doing it. How has this impacted him with your health turnaround?
He's just so excited each day to see that I'm up doing things, call me and ask me what I'm doing, and he's just happier. he's not as stressed because he doesn't have to worry about me as much.
Yeah. Well, congratulations, Jane. I am
Thank
so
you.
proud for you. It seemed like there were times that were pretty bleak, and
Ye-
perhaps it didn't seem like there was a lot of hope or there was any room for improvement, especially with the mounting number of diagnoses that you were accumulating. But to be able to say, I don't have that anymore, and I don't experience that problem anymore, must feel so empowering and so exciting, and like you're just ready to live your life.
Yes, ma'am.
Congratulations. I am so beyond happy for Jane and her sweet husband because she's off oxygen. I mean, that is something that her pulmonologist is shocked about, and for good reason, because a lot of the time, interstitial lung disease is not something that gets better, right? It's a progressive illness. But in her case, her inflammation has clearly decreased. She doesn't have that need for continuous supplemental oxygen during the day. What a huge win. Also, the joint pain that she had been plagued with for decades is gone. It's gone. And she's getting her energy back and able to go back to doing the things she enjoys doing. Couldn't be more happy for Jane. If you could relate to anything in Jane's story and you have a chronic health condition that you may have been dealing with for some time, or it's something that's just creeping up and you want to address it now, reach out to the team because they will have resources for you that can help. There will be a link above or below this video to get you hooked up with the team and get that information. If you know somebody who could benefit from this video, share the information. Sharing is caring, as Dr. Maggie likes to say. So on behalf of Dr. Maggie Yu and the whole Transform team, I'm Anna Manuel. Thanks for watching.
Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. I and my team look forward to talking to you to learn more about you to see if we are indeed a good fit to work together. Thank you.